Hello everyone. Thank you for joining today's Data Element Library webinar. On June 21st, 2018, the Centers for Medicare and Medicaid Services launched the first Data Element Library, a public resource for providers, vendors, researchers, and other stakeholders that use CMS assessments. During this webinar, CMS will review the Impact Act, Standardization, and Interoperability, and also provide an overview and demonstration of the Data Element Library. A question and answer session will follow the presentation. The slides from today's presentation will be posted on the About Data Element Library webpage following today's webinar. I will now turn it over to Beth Connor from the Center for Clinical Standards and Quality in the Division of Chronic and Post-Acute Care at CMS. Please go ahead.
Thank you very much for the introduction, Stephanie, and hello, everyone. As Stephanie mentioned, my name is Beth Connor. I work in the Quality Center at CMS, specifically in the Division of Chronic and Post-Acute Care. And you can go to the next slide, please. This is our standard disclaimer. We can go to the next slide. And we can even move on from this slide since Stephanie did such a great job introducing what we're going to talk about today. And on slide 3, you'll find, which is the next slide, you'll find a list of acronyms that are used in this presentation for your future reference. You can refer to that as needed. Next slide, please, slide 4. Slide 4. So while we're waiting for the next slide to come up, today we'll be talking about the Data Element Library, was mentioned, and I'll just begin with a little bit of background information. So the Division of Chronic and Post-Acute Care is responsible for post-acute care quality reporting programs, and that includes programs for inpatient rehab facilities, skilled nursing facilities, hospices, home health agencies, and long-term care hospitals. There are about 33,000 post-acute care providers in the United States. About 1/3 of all Medicare hospital patients are discharged to post-acute care settings. With the current aging population, it's anticipated that the use of post-acute care services will increase. And with that comes the need for health information exchange and care coordination across settings to support improved health outcomes. And next slide, if we could get to slide 5, that would be great. Okay, wonderful. So I'm going to start off, again, with some background information. The Impact Act, or the Improving Medicare Post-Acute Care Transformation Act, is a bipartisan bill that was signed into law in 2014. The Act requires the use of standardized Medicare quality measures and assessment data in post-acute care settings, and also requires that the standardized data be interoperable. The intent of the Impact Act is to support access to longitudinal information to help inform clinical decision-making and promote coordinated care, to enable comparison of data across post-acute care settings, to improve discharge planning and health information exchange, all of which will lead to improved efficiencies, improved quality of care, and improved health outcomes. Applicable settings and their associated assessment instruments, which are called out by the Impact Act, include long-term care hospitals, and the assessment instrument they use is the Long-Term Care Hospital Continuity Assessment Record and Evaluation Dataset, or the LCDS for short. Skilled nursing facilities, which use the Resident Assessment Instrument, RAI, Minimum Data Set, or the MDS for short. Home health agencies, which use the Outcome and Assessment Information Set, or the OASIS. And inpatient rehab facilities, which use the IRF-PI, or the Inpatient Rehab Facility Patient Assessment Instrument. And next slide, slide 6, please. So what do I mean by assessment instruments? Post-acute care providers are required to submit patient data to CMS via the assessment instruments that I just mentioned. And so content in these assessment instruments includes questions such as administrative information, perhaps the patient's name, date of birth, their Medicare number, but as well clinical information. So on this slide, you can see example questions and their response options, which are found on several of the post-acute care assessments. So just to give you some idea of what we're talking about here. And next slide, slide 7, please. The IMPACT Act requires post-acute care providers to report standardized assessment data on specific quality measures and on resource use and other measures. As you see on this slide, there are specific quality domains that must be implemented by statutorily required dates, and those include functional status, skin integrity, measures on medication reconciliation, the incidence of major falls, the transfer of health information, as well as measures on Medicare spending per beneficiary, discharge to community, and potentially preventable hospital readmissions. Most of these measures have been implemented or they will be implemented shortly, as noted by the dates on the right. Next slide, please. The IMPACT Act, so this is slide 8. So the IMPACT Act calls for post-acute care providers to report assessment data for each of their clients through the post-acute care assessments no later than the dates listed here for both admission and discharge in the following categories. And those include functional status, cognitive function and mental status, special services, treatments and interventions, medical conditions and comorbidities, impairments, and other data as required by the Secretary. Reporting of this data supports the collection of longitudinal information which can be used and exchanged to inform person-centered care over time. And post-acute care assessments must be updated to include the standardized items that are mandated by the IMPACT Act. And next slide, please. And we're going to talk a little bit about standardization and interoperability and exactly what that means. The next slide, slide 10. So what is standardization? At CMS, the Division of Chronic and Post-Acute Care is aligning the questions and answers on the post-acute care assessment to be uniform as much as possible. And this is so that concepts are measured in the same way and data can be compared across settings. This slide represents standardization of eating as a clinical concept. In this example, the concept of a person's ability to eat is assessed the same way across settings. A person may require no assistance with eating or be totally dependent on others for eating, regardless of the setting where they receive care. By measuring a person's ability to eat in a standardized way, we're able to compare their progress or lack thereof over time and across care providers, whether that's in a post-acute care setting, acute care setting, or at the person's home. And measuring in a standardized way also allows us to transfer information about the patient more easily. So the focus is no longer on the care setting, but on the person to help inform person-centered care. And next slide, slide 11. One of the first steps towards effective health information exchange is to standardize concepts so that everyone has the same understanding of clinical content. Section GG on the IRF-PI, the LCDS, the MDS, and the OASIS assessment deals with self-care and mobility. In this example, the questions on the right ask about a person's ability to move, and the responses on the left describe a person's independence with these tasks. As I mentioned, it doesn't matter whether a person is in an acute care setting, a post-acute care setting, or at home, their ability to move is assessed the same way. This information that is electronically supplied to CMS can be used for multiple purposes, and that includes for quality reporting, for payments and payment reform, but it could also be used by providers for care planning or quality improvement activities, and as well for health information exchange when a person transitions from one setting to another. The providers can collect the data once, but it can be used multiple times, therefore reducing provider burden. And next slide. So this slide, so with slide 12, this slide provides a visual representation of CMS assessment standardization. And while many items will be standardized, there will never be 100% standardization across assessments because different settings have different needs. For example, persons in long-term care hospitals may have different assessment needs than patients that are receiving home health services. And just to note that some of you may be aware of the FASI tool, which is under development for use in long-term services and supports, and FASI stands for Functional Assessment Standardized Items. Those assessment questions will be standardized with post-acute care assessment questions, so including items on functional abilities. And so the aim is to develop assessment items that can be used for all settings. So that center point that you see there that we're looking for uniformity. And the next slide, please. And as I mentioned, the IMPACT Act also specifies that post-acute care assessment data be interoperable, meaning that it must be easily exchanged between electronic systems. So interoperable data enables more seamless, less costly health information exchange, reduces overall provider burden through the use and exchange of healthcare data, promotes high-quality, personalized, and efficient healthcare, supports provider exchange of electronic health information to facilitate care coordination and person-centered care, and supports real-time, data-driven clinical decision-making. And next slide, please. So this graphic demonstrates how complex the healthcare system can be. It's important for data to follow the person from one setting to another at the time that it's needed if providers are to deliver high-quality, safe, and efficient care. Ideally, data will follow the person as they navigate the healthcare system, whether that's an acute care hospital, a post-acute care facility, or whether the person is at home receiving long-term services and support. We need to find a way to easily exchange data between providers and with our beneficiaries to help reduce burden and improve care coordination for better health outcomes. So we're shifting the focus. The focus is no longer on the care setting, but on the person to help help drive and inform person-centered care. And next slide, please. So with this background information in mind, I'll introduce the Data Element Library. If you can move to slide 16, the next slide. So the Data Element Library is a centralized resource for CMS assessment data elements, or the questions and responses that are found on the assessment instrument, and their associated health IT standards. So we've placed all of the post-acute care assessment questions and responses, which we're terming data elements, and their details into a searchable database. In the Data Element Library, information on data elements includes details about the assessment version, item labels and status, copyright information, how the item is used by CMS, so is the item used for payment purposes, for quality measurement, for survey and certification, as well as other details. But importantly, we have mapped the data elements to nationally accepted health IT standards to support electronic health information exchange across settings. And I just want to point out that there is no patient-level data in the Data Element Library. There's no PHI or PII. It truly is just a database of the questions and response options that are found on the post-acute care assessment. And the link to the Data Element Library can also be found on this slide if you want to check it out. So next slide, please, slide 17. This slide summarizes standardized and interoperable data flow and how the DEL supports data exchange. So just to recap, post-acute care providers are required to electronically submit data for all of their patients to CMS, and for a variety of reasons, including quality measurement and for payments, for example. They do this through the use of post-acute care assessments. And the DEL has placed all of the questions and response options, or the data elements, for these post-acute care assessments into a database. And then we've mapped each one to nationally accepted health IT standards to support the electronic exchange of health information in electronic health records or other health information technologies. The information in the DEL, or data that is collected, can be used for a variety of purposes by health information exchange organizations, EHR vendors, or other stakeholders who are interested in CMS assessment content. And next slide, please. So what is a health information technology standard? Healthcare organizations exchange information according to a set of health IT standards. And standards are agreed upon methods for connecting electronic systems together. Standards may pertain to security, data transport, data format or structure, or the meaning of terms. The Office of the National Coordinator for Health IT, or ONC, has recognized health IT standards to support interoperable health information exchange. And these include Logical Observation Identifier Names and Codes, or LOINC, Systematized Nomenclature of Medicine Clinical Terms, or SNOMED-CT codes, Consolidated Clinical Document Architecture, CCDA documents, and Fast Healthcare Interoperability resources. The DEL will include mappings between the assessment items, the data elements, and these standards when feasible. So in the initial version of the DEL, CMS has linked the assessment data elements, so the questions and response options, to LOINC codes, with a few exceptions here and there. The DEL contains mapped LOINC codes for the current LCDS 4.0, which just began July 1st of this year. We also have LOINC codes for the IRF-PI 2.0 and the MDS 3.0 version 1.16, which are due to go into effect in October of this year. And we also have LOINC codes for the OASIS-D, which begins January 1st of 2019. We're working very closely with Regenstrief Institute to procure LOINC codes, as we continue to work with our colleagues at ONC to be sure CMS and ONC efforts towards interoperability are coordinated. We're also beginning to work with IHT-SDO, which is the International Health Technology Standards Development Organization, to obtain SNOMED codes for response options when they are available. So having these data elements linked to nationally accepted health IT standards supports health information exchange between providers. These codes can be used by IT vendors who create software for post-acute care and other providers to help electronic health records and other health IT systems communicate with each other. For example, these codes could be incorporated into electronic documents such as care plans, transfer documents, consultation notes, or referral documents. The Data Element Library team is also exploring how the assessment data elements map to CCDA documents and FHIR, and we are looking for volunteers to help us test how FHIR mappings could be implemented and used in health information technologies, if there are any vendors on the call. And we should be on slide 19 now. We've lost our connection here, so I'm assuming that we're on slide 19, Dell uses. Okay, great. So the DEL is a free public resource for providers, vendors, researchers, or other assessment stakeholders. They can search and obtain reports on current CMS assessment content, including the details that were mentioned earlier. Regular updates include new and modified data elements, new assessment instrument versions, and new and updated health information technology codes. The DEL is intended to support the development of software solutions that support the electronic exchange of health information across providers and with patients. We're standardizing assessments so we're all speaking the same language. And then the other intent is to exchange the data seamlessly between providers so that data follows the person across settings and over time. HIT vendors will be able to download a report of mapped data elements, which could be used to develop health IT software for post-acute care, but also for other providers who are going to be exchanging information across settings. There are no requirements to use the Data Element Library, but it could prove to be a very useful resource. We have all the assessment content in one location. This is our first release of the Data Element Library. CMS is hoping to receive feedback from the healthcare community. What types of reports or files are needed? Is there content in the Data Element Library that you find useful or not so useful? Is there other functionality or other items that you would like to see included in the Data Element Library? So as we continue to modify the Data Element Library, your input would be very helpful as we make improvements. The Data Element Library is laying the foundation for interoperable exchange of standardized assessment content, and we'll continue to work closely with ONC to align our interoperability efforts. But we're also hoping to partner with other stakeholders who might want to continue with us on this journey. And the last slide on the deck, I believe, has some contact information where you can be able to reach us. So next slide, slide 20, I believe, or 21. So at this point, I just want to, NIC and Telligent are the contractors that were involved with the development, maintenance, and operations of the Data Element Library. And at this point, I'm going to introduce the lead program manager, Jana Linthicum, who works at Telligent, and she's going to be giving a demonstration of the Data Element Library. Unfortunately, we were unable to provide a live demo today, so we'll be showing some screenshots. But if you wish to follow along as we move through the screenshots, you can type the DEL address into your browser. So you can either Google Data Element Library and select it, and it'll take you to the home page, or you can type in https://del.cms.gov. And at this point, I'm going to turn it over to my colleague, Jana Linthicum. Thank you.
Thank you, Beth. Next slide. So this is the home page of the Data Element Library. It will provide you a description of what the library is, the mission and goals, what's included in the Data Element Library, or not included, like no patient-level data, and a link to sign up for the listserv to get more information. In the upper right corner, you see the links to get to the help page. Or if you're on any other page, you can click the home link there, and you'll return right back to this page. The announcement section will contain information about updates to the Data Element Library or anything else that CMS would like to pass on in regards to the library. Next slide, please. This is the help page that will be displayed when you click on the help button in the upper right corner from any of the pages. You can see that there is an email listed for the QualityNet Help Desk that can be used for any questions, comments, or issues. Also contained is a link to the user guide that's in the PDF format, which will provide information to you about the available searches and reports that are available in the DEL. You also see a table of frequently asked questions. This frequently asked question table will continually be updated as we receive more questions. Next slide, please. This is the search menu page. You can get to this page by clicking on the search option in the yellow bar near the top of the page. There are two categories of data to search for. data elements, which are the questions on the assessment instruments that Beth spoke about, and the hit codes that are assigned to the questions on those assessment instruments. For a data element, you can search by an ID, which is the label listed on the assessment instrument, like GG0170C1, by text, if you don't know what the label is or want to see all the data elements that are related to a word or a concept like pain, by assessment instrument version, if you know the data element is on a specific assessment instrument version like the MDS 1.15, you can search by item subset. So if you know that data element is asked on the LCDS admission, you could use this search. Or by status. If you know the data element is actively collected or has been published in a final rule and be collected in the near future. For the hit codes, you can search by the assessment instrument version. So if you wanted to see all the hit codes assigned and collected in the DEL for the entire instrument. By ID, so this is the data element ID, and you would have to know it, and you could see all the information on that specific element for the hit code. Or you can search for a hit code by text, if you want to see the hit codes for a type of question, like a pressure ulcer. Next slide, please. This is the data element search by ID criteria page. You're able to enter 1 to 10 characters of the item label from the assessment instrument. The search will find any data elements that contain the characters you enter, so if you don't know the whole ID, you can enter as much as you know. Next slide, please. Once you've clicked search on the previous screen, you'll receive the result list for what you had entered. This is a result list for GG0170. You see that the data element exists on multiple assessment instruments and also has children questions like GG0170A1. All of the columns on this result list can be sorted. So if you wanted to see everything that was on an assessment instrument together, you could sort by assessment instrument. When you find the data element that you want more information on, you can click on the hyperlink in the item ID column. Next slide, please. This is the detail page that you'll receive when you search for a data element and you chose a result on the previous screen. You can see information such as the assessment versions that the data element is on, the full text of the question from the assessment instrument, the valid responses for the data element, if that data element triggers a skip pattern, the look-back period, the status and status date of the standardized data element, how the data element is used on the assessment instrument, when the data element is collected, so this one is on admission, if there is a hit code assigned to that data element, and any copyright information that's associated with the data element. Next slide, please. This is the data element search by assessment instrument criteria page. You can pick an assessment instrument and their version, and you'll be able to see all the information listed on those assessment instruments. Next slide. You again see the exact same result list page that we saw when we searched for data element by an ID. Again, you can click on the hyperlink of the item ID to see more detail. Next slide. Again, we see the same detail page that we saw when we searched for the data element by ID and has all the same information. You'll see at the bottom of this page, for data element C1610A, there's copyright information that is included. Next slide. This is the data element search by text criteria page. You can enter between 3 and 30 characters. The search will look in multiple places for the text that you entered, such as the short name, the question full text, and any response text. Next slide, please. Again, we see the same result list, and you'll see all of the data elements that had the word you searched for listed below. Next slide, please. So again, the same detail page that we've seen. So as you see, as you search for a data element in many different directions, you can always get to the same exact page. Next slide, please. This is the Reports menu page. You can get to this page by clicking on Reports in the yellow bar near the top of the page. You see we have the same two categories we saw in the search menu, data elements and hit codes. The data element information report can be used to get details about a single data element. The data element across provider setting report can be used to show you if a single data element is used on multiple assessment instruments and is standardized in the data element library. The data element by assessment instrument version report will show you the details, though not as many that you found on the data element information report, on all the data elements on a specific assessment instrument version. The download hit codes report will give you details on the data elements for a specific assessment instrument version and their hit codes that are contained in the DEL and for the data elements that are on that assessment version. Next slide, please. So this is the criteria page for the data element information report. As I mentioned before, it is run for one data element and is based on an item ID or the label on the assessment instrument. If you don't know the item ID, you could first run a search by text and locate the item ID. Next page, please. The report that generated is a PDF. It contains a lot of the same information that we saw on the detail page from the searches on data elements. Next slide, please. This is the download hit codes report criteria page. You would choose the assessment instrument and the assessment instrument version that you wish to receive the hit code information for. Next slide, please. This is the CSV file that is produced for the download hit code report. When you open it in Excel, you can find, sort, filter, and perform any other functions that are available in Excel. If we have information on more than one HIT standard, such as LINC and SNOMED, it will all be included in the same report. Next slide, please. And I will hand it back over to Beth. Thanks.
And thank you, Jana. If we can, we're on the resources side, which is slide 38. I believe. So if you would like to find more information, find out more information about the IMPACT Act, you can visit the IMPACT Act webpage at the link listed here. Also, to sign up for the listserv, for the Data Element Library listserv, we provided that link here, but it's also, for some reason you can't access these slides, it's also on the DEL homepage at the very bottom. You can click on the link there for the listserv. If you'd like to find out more information on post-acute care quality reporting programs, we've provided the web links there, hyperlinks. And then if you have any questions or would like to provide feedback on the DEL to help with future DEL development, please feel free to shoot us an email at delhelp@cms.hhs.gov. We really are looking towards the community for feedback about the Data Element Library, vendor input, and so that we can make it as useful and usable as possible. And just a reminder, too, there is no patient data in the Data Element Library. I know that can be, I see a couple of questions come in about that. It really is just a database of the questions and the response options that are found on the assessment instruments, but not the actual data that is being collected on patients. And I think with that, I will turn it back over to the moderator, and we can take questions at this point.
Stephanie, can you please give instructions for asking a question over the phone?
Thank you. We are now going to start the Q&A portion of the webinar. CMS subject matter experts will address any questions you may as time allows. You can ask questions via chat or phone. To ask a question via the phone, please dial 1-866-452-7887. Once you have joined the call, you will need to press star, then the number 1 on your telephone keypad to ask your question. Again, that's star, then the number 1 on your telephone keypad to ask a question. We'll pause for just a moment.
Thanks, Stephanie. While we wait for people to dial in over the phone line with their questions, we did receive a couple questions through the question and answer box. The first question, how does the DEL align with the ONC USCDI common data elements?
Yes, hi. Thank you for that question. Good afternoon, everyone. This is Liz Polina-Hall with ONC and also on detail to CMS and Division of Chronic and Post-Acute Care. Thank you for that question. It's one that we've been getting quite a bit lately. And so to answer that question, I'm going to provide a little context for what is the USCDI. And we'll start with just the 21st Century Cures Act, which was passed by Congress in 2016. And one of the provisions or the requirements in the Act is to develop or support a trusted exchange framework, including a common agreement among health information networks nationally. And so ONC is currently working to implement this provision of the Cures Act, and it will enable healthcare providers to join one network and have access to data on the patients that they serve, regardless of where patients go for care. And it will also, the draft Trusted Exchange framework also sets up an ecosystem whereby qualified health information networks can connect to one another to support a variety of use cases. So you can think of it as a network of networks. But to enable the broadest set of use cases, these qualified health information networks and their participants will be required to exchange what we're calling a U.S. core data for interoperability. So this set of data can be made available across these networks. And in the draft Trusted Exchange frame that we published earlier this spring, ONC also published this, the USCDI, and proposed expansion of how additional data elements may be added over time. And as you look through, if you look through what's been proposed in future iterations of the USCDI, you'll see things like function, cognition, etc. And as we think about the DEL, this is a perfect opportunity whereby some of the best standards available for things like function and cognition could become in the future part of what would be the expansion of the USCDI. So thank you very much for that question.
Great, thanks, Liz. The next question, could you please give an example on how a specific facility, such as an IRF, would need to use this tool?
Yes, hello, this is Beth Connor. So an inpatient rehab facility could use this tool if they're interested in finding out detailed information about the IRF-PI assessment. So they could search for information about the IRF-PI via the search boxes. They could also be in touch with their health IT vendors who would be able to use the content in the Data Element Library when they're creating health IT solutions to help the IRF facility with their data, their patient data. So there's a variety of ways that the DEL can be used, whether that is by the facility itself or by the vendors who are supporting data collection for the facility.
Great. Thanks, Beth. Stephanie, do we have anyone on the line?
Again, if you would like to ask a question, please press star, then the number 1 on your telephone keypad. We'll pause again to queue the roster.
Okay, we'll continue through the questions that came in through the FAQ box. Is the FHA Federal Health Information Model aligned with the DEL?
We have not looked into the FHA model at this point in time, so it doesn't really apply to the Data Element Library right now.
Great, thank you. Can the DEL be filtered to specific states?
I'm sorry, can you ask that again?
Sure. Can the DEL be filtered to specific states?
No, there's no state information here in the Data Element Library, but states could adopt the content that is in the Data Element Library. So for example, if states were looking for an item to help evaluate whether someone was able to receive long-term services and supports, they could search the database, find questions that might apply to their assessment needs, and determine whether those questions and response options are standardized in other settings, so in post-acute care settings, and then possibly use those for those assessments.
Great, thank you. Stephanie, do we have anyone on the line?
There are no questions at this time.
Okay, we'll keep going through these next couple of questions. Are the HIT codes available on NLM's VSAC Value Set Authority Center?
So right now, the HIT codes, the Data Element Library is not aligned with VSAC, the Value Set Authority Center. However, we are currently in conversations with folks over at NLM to see how we can align the Data Element Library efforts with the VSAC. We understand that VSAC is the one-stop shop for vendors to find information needed in terms of health information technology. And so we're looking into that, and there may be something in the future.
Great, thank you. The next question, can you please explain how the Data Element Library is different than CMS's Clinical Data Element Library created for DME and HHA?
This Data Element Library, this is Kate Mandel from CCSQ, this Data Element Library simply has the questions and answers in the assessments that are used in post-acute care currently, and the HIT vocabularies that are associated. I'm not necessarily familiar with the other database that you're referring to, but we can look into that. But it's a little easier for me to just speak to exactly what this CMS Data Element Library pertains to.
Great, thank you. Stephanie, any other callers on the line?
No questions at this time. Again, star 1 to ask your question.
Okay, we have one last question in the Q&A chat box. Could you please give, similar to the earlier question, could you please give an example on how an SNF would use this system?
Did you say SNF?
Yes, skilled nursing facility.
Oh. Skilled nursing facility. Okay, sorry. How a skilled nursing facility would use it? It's similar to the same. It's the same answer for the inpatient rehab facility question. The skilled nursing facility could use the content that's found in the Data Element Library if they were interested in finding detailed information about the MDS. Including, what are the most current assessment items that will be coming up or will be put into place in October of this year for the MDS version 1.16. So you can see in advance what's coming next. and then also vendors who work with skilled nursing facilities or other vendors as well can go to the Data Element Library, find the health information technology standards that are included there, and use them when they're creating software for skilled nursing facilities.
Great, thanks. We have one last question. For researchers who may be using data from previous years, is there information on how long the element has been used?
When you look at the details page, so if you search for a specific data element, and you'll come up with the list that Jana showed you, and then you select an item. On that item, you are able to see when the item was implemented, so whether it was on MDS version 1.14, 1.15, and 1.16. So not necessarily a specific date other than the month and the year when the version that it was first started on became active.
Great,
hope that helps.
Thanks. Any other callers on the line, Stephanie?
We do have a question from Andrew Baird.
Hope that helps.
Any other callers on the line, Stephanie?
Hello.
We do have a question. Hi,
Can you hear
Andrew.
me? Hey there,
Yes.
how are you? Hey there,
Good.
sorry, we just had some trouble between the phone and the computer, a little bit of a lag. My question was just about the information that's going to be in the entries for the data elements. I thought that we had seen earlier in the presentation on the slide that the entries would include how the data elements are going to be used generally, whether or not they're part of a quality measure or for payment purposes, et cetera, et cetera. Is that available on the entries? I didn't see that in the example or in our searches separately for that. So I was wondering if that's something that's planned for the future or if that's something that we have as a functionality now.
It is a functionality that we have now. So if you select an item and you go to the detailed information about that item, in that list of information, so it includes which assessment, which version, the exact question text, the exact response text, and as you follow on down the page towards the bottom, it will say CMS uses. And if the item is used in a quality measure or for payments or for survey and certification, it's noted there. Not all items are used for those purposes, so not all items will have that information. And if there is no use, then you would see a star in that space.
Got it. Thank you.
You're welcome.
And we do have another question from Brittany Clausen.
Hello?
Hi, Brittany.
And we do have another question from...
I was wondering if any of these training sessions have anything to do with the PBJ side of it.
No, they do not. I'm not familiar with PBJ, but no, they do not.
Do you know how I could find the training options for PBJ?
If you were to shoot me an email, then I can certainly find that information unless Stace, you know?
No, I would actually recommend contacting the Office of Communications or looking at the nursing home website. They may have information on when those trainings are. This particular training is specific to the Data Element Library. Unfortunately, we really don't have at our fingertips the assorted types of trainings for the other programs. Apologize for that.
Okay.
There are no additional questions at this time.
Okay. Beth, I think that we can go ahead and end the webinar unless you have any additional thoughts or anything you'd like to add.
No, thank you very much, everyone, for joining today. We really appreciate your interest in the Data Element Library, and I think I speak for myself and everyone here at CMS. We appreciate you taking the time out to listen and hear what's going on. So thanks very much.
And thank you. This concludes today's conference call. You may now disconnect. Speakers hold the line.